So, delay versus disorders has always been a debatable topic. But primarily, for my practice, I always just look at age. So, kung yung skills ba nila developmentally versus their chronological age is so far apart, that's most definitely a disorder. Other than that, a disorder can be identified kasi when we look at the language skills or speech skills, so makikita namin na on some area sobrang poor, pero on some area sobrang galing. So that's also a grounds to consider that the kid has a disorder rather than a delay.
We can tell that the child is delayed if the language skills of the child is not at par with his or her peers. So,
better pa rin siguro talaga na makapagpa-check up sila sa isang developmental pediatrician. So, marami kasing specialized doctors, but I think for that concern siguro, better kung sa isang developmental pediatrician. Kasi, given yung specialization ng doctor na yon, talagang very detailed niyang ini-evaluate for each domain. Let's say physical, gross motor function, fine motor functions, cognitive, intellectual behavior, kung age appropriate ba yung pinapresent ng bata.
Okay, so early intervention, very broad siya, but early intervention is basically direct intervention for those at the young age. So, that comes with early detection din. So, that comes with the parents determining then na that their kid has a delay. So, early intervention is very important kasi when you're younger, your brain, mas nakapag-expand siya, mas nakapag-absorb siya ng information. It's still growing. There's a lot to change. There's a lot to do pa.
you have to take advantage of that neuroplasticity of the child. So we're basically taking advantage of the age of the child, around 2 to 6 years old, where the child is really malleable. The child has an easier time learning concepts.
So, speech therapy, parang the name itself, speech therapy, we tackle yung talking talaga, communication. So, what the speech therapist does is only to provide a lot of language stimulation to help the kid be able to use his or her words.
First, they have to consult a developmental pediatrician or a neurodevelopmental pediatrician before the doctor sends them to us for speech therapy.
For assessment, we always go first with the case history because we want to know about the background of the child itself. So, meron ba siyang prior medical diagnosis or what are the parents' concern regarding their speech and language, ganon. So, after all that case history, ganyan, we always go with an assessment of the child's behavior, the child's oral peripheral mechanism, or in layman's terms, yung ginagamit nating structure sa speaking. So, yung mouth, yung lips, yung tongue, if there are any problems with that. And then we go to play assessment. So, we use play in order to rate or parang see what the level of the kid is in terms of speech and language depending on yung theoretics namin. And then afterwards, we make sure to counsel the parent what they can do at home. Kasi part ng early intervention yung very active family involvement kasi kailangan talaga nilang mag-follow up sa bahay. Kasi early intervention is very intensive and you can't always expect na lagi lang silang nasa therapist. So, a lot of family involvement is also encouraged in early intervention.
The effectivity of the therapy itself rests on the partnership between the caregivers. The therapist can do anything he wants. Kaya niyang gawin sobrang daling na therapy. But if the caregivers cannot translate it at home, remember na kasama namin kid for 1 hour a week. The rest of the week, they're with the caregivers.
So, it's important for parents to be open on what they can do for their child. It's a tough thing to accept. Pero if they really love their child, they can do something about it. Kasi if they don't help their child, who will?